All right, everybody. Today I'm just going to record a lecture on evoking change talk, and then I would like you guys to watch a video that I will post. I also have a couple of documents that I'm going to post that you can look at, and I will reference here in this presentation. So you guys have already listened to William Miller talk about sort of how he established motivational interviewing, and so now I want to do a quick overview of at least the beginnings of motivational interviewing, specifically listening techniques and some question asking techniques. These are definitely not all of the techniques for motivational interviewing. I am using a book called Motivational Interviewing in Healthcare, which is by Rolnick and Miller. It's an excellent book. I'd recommend it. And I'm giving you some of the skills that I think are interesting, at least to begin with, in this book here. This book is what I'm definitely using for the source of this presentation. In the book, they talk about the spirit of motivational interviewing, and just because I think it's been around for such a long time that people it seems like they feel like people have lost what the point is here, and the point is really about how motivation is in within each of our clients. All of our patients are motivated. Even the most ambivalent, seemingly unmotivated people have motivation in that they contain it, and our role as a provider isn't to tell them why they should be motivated, but rather to sort of allow them to express that. You give them the opportunity to talk about reasons why they should change, or reasons why they want to improve their health, or they want to do this or that. Giving them that opportunity to is the whole point, because what they've shown is even in really brief one-time conversations, people who do this change. They tend to change. And so the effort is, the spirit has to be collaborative. It's not like I'm the provider, you're the patient. Yes, tell me all your reasons. Okay, those are very good reasons, but here's really why. It's collaborative. It's your equal partners in this role. And the role as the provider isn't to sort of have this great knowledge understanding, but rather to evoke that knowledge understanding. Because like I said, most patients know that this is bad for them. They know that this could hurt them, or whatever the example is, and so you're evoking their own thoughts and feelings about it, and a lot of times they really do desire to change, and so you're allowing them to express that and be affirmed there, and honoring the fact that they have the right and the ability to do these things. So here we have the 4 guiding principles for motivational interviewing, or the rule. Resist the writing reflex, and this is when we want to correct our patients and telling them what the recent evidence shows. But what we really know is that patients know what's bad for them, and they know what they're doing that's bad for them, and so by us telling them bad for them, really we're not telling them that, hey, this isn't good for you. We're saying, hey, defend your actions, please. And we know that when we make somebody be defensive, that really they're making that opinion of theirs more believable to themselves, and it really concretes that opinion if they have to defend it. Beginning to understand our patients' motivations, and this, we're going to talk about listening. Really trying to empathize with what's going on in their situation, and a lot of times, like I said before, empathy comes from imagination. Just trying to understand, put yourself in their shoes, listening to your patient, and then empower your patient. The 4 guiding principles for motivational interviewing. So the book that I'm talking about, it tries to focus motivational interviewing in a healthcare versus a counseling setting, because it was kind of established by counselors. And there's really sort of 3 styles to how you approach any interaction in a healthcare setting. There's guiding, there's directing, and there's following. Okay, and following, a good example would be like that. If someone's, they're really just having a hard time. And so you just, they're really stressed out, or they're crying. When you come into someone's room and they're crying, you just sort of follow their lead as far as what they need, or if there's a death and there are people that are grieving, it's like a chaplain or the nurse will come in and they just follow whatever the needs are in the room. Okay. When you direct this is sort of, when you're telling the patient what to do, so to speak, this kind of setting could be good, like in an ER or something where like somebody's dying, or there's a code, or there's an intense, a lot of skills that need to happen. You're just using a lot of direction, and, you need to do this, you need to do that, go do that. But, what we notice is that healthcare workers use direct a lot as far as their communication styles. And then guide is sort of in the middle there, where you're sort of following their lead and you start help giving little directions. You're just kind of in between there, which is probably where a majority of our time can be spent. However, there are definitely areas where directing and following are important. And so these are the skills that you have for communication. You have, your ask, listen, and inform. Essentially when you're asking questions to do your assessment, ideally when you're listening to what they're saying, you're listening to sort of what you're seeing them, if they're groaning or they're, hunched over or they're unconscious, you're sort of listening to that data, so to speak, to yourself. And then there's informing, which is, again, something that we really rely on in healthcare. We're professionals. We're, gone through all of this training and education, and we know what's best, so we're just going to tell you it, and we're going to give it to you. We hand them all papers when they leave, teaching them how to do it. And so what we see here is a little graph here. When you're doing a directing style, a majority of your communication is informing, okay? And when you, you're asking somewhere in the middle, and then you're just not listening a lot, right? Oh, you have a heart, you have, cardiovascular disease, or you have diabetes. Here, let me tell you all of this really good information about diabetes. A lot of it they may not know, and it could be important, but we do know that they do. Our patients are very smart, and a lot of times when they have these chronic illnesses, they will know absolutely a whole lot more than you will. But we still get stuck sort of in this directing style. Over here in the following style, there's more listening, but you're not doing a lot of informing here. There's not a lot of content that we're giving them. Just sort of following along, and then guiding. The idea is you sort of have this even flow of informing, asking, and listening. Okay. So here are forms of change talk that you can hear people say that we want to start paying attention to, because once we hear these things, there's something that we can start we reflect on and allow the conversation to sort of be guided towards change, right? We want to elicit this change. This is what we want to try to have people say these, things like this. And so desire, ability, reason, need, commitment, and taking steps, okay? Desire is really your I want statements. When somebody, wants or desires something, they're going to say something like, I wish I could lose some weight, exercise, like that. I want to get rid of this pain. I like the idea of getting more exercise, right? You're sort of speaking to the desire when you're listening for their desire, okay? A is your ability. I think I can come in twice a week. I could probably take a walk before supper. I might be able to cut down a bit. I can imagine making a change. And so the ability-related change talk also signals motivational strength. Speaking to whether or not they have the confidence or ability to do something. So with reason, there are not really any verbs to hear there, but this is, they're telling you why they think. And so I would feel better if I exercise regularly. I want to be around my grandchildren more when they grow up. It keeps me from being able to play the piano, and I know smoking would improve my health. So these, when you hear these are reasons why they would want to change. These are the must and need and should and ought and have and to verbs, where they must get some sleep. I've got to get back some energy. I really need to get more exercise. It speaks in necessity. So these four are really your pre-commitment forms of change talk, and you can remember them by saying darn or thinking darn. And these lead to direction to change, but they don't by themselves facilitate change. And they can be intermixed, and a lot of times they contain some form of ambivalence. Like, I really should, eat better, but I can't always make it to the grocery store to buy vegetables. Or I would really, I really want to exercise more, but it really hurts my knee when I go on that running machine. Or I'd love to cut down my cholesterol, but I do love some eggs and cheese, right? A lot of times they'll give you that ambivalent form here. So the commitment form of talk here, we have commitment here, which is the I will, I promise, I guarantee phrases. And there's also this lower level of commitment that is important not to ignore. But like, I'll think about it, or I consider it, or I plan to, or I hope to. And these are starting, when you start hearing these words and you start reflecting on these can help, facilitate that change. And then here's the taking steps. I tried a couple days without drinking this week. I borrowed a book from the library about aerobic exercise. We went the whole month of February without eating meat. They're saying these things, and these are actually steps they're taking that make that change in their life. So if you wanted to start asking questions that might help guide people, because like you said, the more people use change talk, the more likely they are to change, right? And so instead of us saying, you should want to quit smoking, how do you elicit that change talk? And here's some questions you might be able to use, like, why would you want to quit smoking? Or why do you want, or would you be interested in, asking them about their desire, asking about their ability, how would you do it if you decided to quit smoking? Or, how confident do you feel like you're able to quit smoking? Having them say those. What for you are the 3 best reasons for quitting, and asking them about reasons, or how important is it for you to quit? Finding and trying to elicit those need comments. So when you start asking questions, it's important to make sure. I think open-ended questions, we know, are better at eliciting sort of a less guided response, right? If we want the patient to guide the conversation, if we want to make sure we're talking about things that are important to the patient, that the patient is likely to change, asking open questions allows them to sort of guide that. Whereas closed questions, it can become very robotic. And we know these closed questions because there's something that we ask our patients every day. What's your address? Where does it hurt? How long have you been feeling that way? What's the quality of pain? What's the quantity, right? This is your holy 8+1. This is essentially what we're trained to assess. And what we notice is when we ask things, especially that are maybe more stigmatized, like how often do you smoke, or how many drinks do you have a day, we really, when we do these closed questions, when we haven't built rapport, when we haven't talked to the patient about what's important to them, a lot of times we get these half-truths. Like, they'll admit to a degree, but they're not going to be as open to us. They'll get defensive. They'll feel defensive in themselves when you ask them these questions. And so, though, especially in really acutely sick people, when we just need to get these information, we really need to gather, to find out, the decision tree making questions, to find out what's going on, in the really sick people. A lot of times we can use open-ended questions to guide the conversation. And even if you're not, I struggle with this personally, you're telling me about anxiety, I want to ask you 8 quick questions about anxiety because that's what I've been trained to do. But instead, just allowing them to explain it in their own words and not guiding it and not giving them the words, but rather just listening. And I think what you notice is when you have these conversations, they'll give you a lot of assessment data. Like they'll if you really are familiar with your assessment, then you keep track of what they tell you, and then you can fill it in later. Or what you do is say, I'm going to open up. So I'm going to ask you some questions, and I want you to tell me what's going on. And then after we've talked for a bit, then I'm going to go and make sure that we haven't missed anything through my assessment form. And that's really this question answer trap. And like I said, I tried this the other day with a patient, and they told me about anxiety. All of a sudden I was like, well, how often do you feel anxiety? How many times a week? What is that anxiety like for you? How long have you had this anxiety? Right? I immediately go through it. And then I stop that and I get all my information for anxiety. And then I want her to continue to talk to me open-ended style. But they don't. I mean, she wasn't willing to. I mean, she was like, oh, this is the name of the game now. The name of the game is the question answer trap, not me getting to openly talk about what I want. So be careful. You're going to hear them say things and you're going to want to immediately dive in there, but try not to, ask question after question. Ask an open-ended question and then use your reflective listening skills, which we'll talk about right now. So here's some useful open-ended questions that you can do right away to try to elicit the patient to just sort of talk about what's going on. What's worrying you the most about this illness today? Or what concerns you about these medications? Or what exactly happens when you get the pain? What did you first notice about your child's condition? What these are doing is they're getting them to talk about what's going on, but without being defensive. Not like, if someone doesn't want to take their medication, you're saying, why not? Or don't you know it's good for you? But instead saying, what's your biggest concern about these medications? You're asking for sort of you're non-partially asking them for their opinion. And what you'll find is they'll be honest with you and they'll tell you what's going on. And a lot of times you can process those concerns without having to tell them that they're wrong or tell them that you know more. Really process their concerns with them. And you usually can come up with a good compromise, or at least, they'll sort of talk themselves into why they're important potentially. So here's the thing with listening. You open the door. It's an invitation. When you open the door with a question, it's an invitation to listen to them. It's not I'm going to guide this conversation. So you ask them really one question, where you say one statement that opens up. So you say, tell me about your experience, or how are you feeling this morning, or tell me about what's on your mind today, or in a little while I'll need to get some specific information from you. But before we do that, let me take a few minutes to hear what made you decide to come in today. Okay. By doing this, you're saying, okay, tell me what's going on, and you sort of say go, and they start talking, and your goal is then to listen to them. And again, listening isn't asking question after question after question. Okay, here's a list of good roadblocks to consider when you are and you're listening, and one of them is questioning. Right here, questioning. So if they say something and you're not sure what to say, if you're being silent, it's good, because what you're not doing is you're not telling them, you're not agreeing with what they say. Oh, that's very good. I do that all the time, personally. I'm constantly agreeing with what they say. I'm constantly, praising them for things that they say. Or like, I'm constantly giving my opinion. But it's, good reflective listening is not agreeing, not disagreeing, no instructions, no questionings, no warning, no reasoning, not sympathizing. That's so sad, or no arguing, suggesting, analyzing, persuading, approving, which I do all the time. I'm constantly approving, like, hey, I went to the gym last week. Oh, good job, right? There's it would be more effective for me to say, it sounds like you're starting to meet your goal, or you're trying to exercise more, right? Something more reflective, not just saying that's a good job, good for you, reassuring and interpreting, right? Because if I told them, if I was approving of it and said, hey, good for you, that's a great job, then really I've done with the conversation. They don't need to tell me anymore because they've got my approval. Or if I say, well, you should really work on that, if they said, oh, I smoked 2 packs last week even though I was trying to cut down to 1, it's like, well, you got to try to work harder. Right, that sort of shaming, since we think maybe we're motivating, but we're not, and they're gonna know they're gonna be ambivalent to tell us again next time, because they don't like that feeling of making us disappointed as a healthcare provider. Okay, so you're silent. That's one of your techniques. Is when they talk to you, just be silent. Just like you'll see me do that with classes. With the class, I'll ask a question to you guys, and then I just don't say anything after that. Right? I don't specify. I don't narrow it down because the silence is awkward. I just let the silence sort of sit there for a moment, and then see if someone talks. Right? You don't have to do that every time, but with a patient, you ask a question, they give you 4 or 5 answers, like, oh yeah, I'm doing pretty good, and just stay silent. Then you're sort of saying, I'm not in a hurry. You can say more if you want, and then a lot of times they will kick in and start talking a bit more. Or you can do something like, or I see, or, tell me more about that, which is sort of the joke about, psychiatrists, or how did that make you feel, right? Something that a robot could essentially do, or a parrot could do, but it's effective. And what you're doing is you're just saying, keep going, I'm listening to you. I'm, at least trying to present like I am. And so those two are okay techniques, silence and facilitative responses. The best way is to reflect, right? It's to give reflection. But the truth is, I want to encourage you that really silence in the other way is okay too. Or asking questions or asking them to elaborate or to clarify are fine. But trying to build your skills to reflect, and I think that's going to take some time. But what you're doing is you're proving you're listening to them and hearing and understanding them by simply restating what they've said in different words. Parrots can't do this. It's not something that a robot can learn to do. So, let's say they say something like, I haven't been spending a lot of time with my daughter. Last week when she was having a ballet recital, I had to walk out because I needed to go get a cigarette. So say something like, it sounds like smoking is getting in the way of your relationship with your daughter, right? You're reflecting what they said. And when you reflect, you're hypothesizing. It's a little bit of a guess. But that's okay, because if you're right, they'll say, yeah, and then they'll continue. If they're wrong, they'll say, like, wow, it sounds like you got really pissed off. They say, no, I don't think I got pissed off. I'm irritated, or, I just snapped a little bit because they got annoyed by them, right? And then they continue, right? They don't get mad at you for being wrong. They just clarify and they move on. And so really what happens is they're sort of teaching you about how, they're teaching you about, the way they feel and the way they react to it. And so you're going to get better and better as you go. So I have here's a example I have here of the practitioner. You said you were worried about your possible condition. Worried is not the word. It's so complicated, I don't know where to begin. And it's causing you quite a lot of distress? Last night I hardly slept. I was so worried. it's like things are coming to a head. So you kind of see, this is the kind of example, and it goes down, and the practitioner is just reflecting after each statement. And so I'd like for you guys to read this. It's a pretty good example of how to do that reflection, because I don't think this is I don't know. It's a good example, and truthfully, the way you're going to reflect is going to be so personalized, anyways. But it is a good example of how you would do that. Okay. So, listen by reflect. So, asking and not listening. Try to ask open-ended questions rather than closed-ended questions. So, tell me about how things are going, or tell me about what brings you in today, or tell me, oh, it looks like you got a cat. Just really open-ended questions, and then try not to ask two in a row. The goal is offer two reflections for every question you ask. And I have another handout here. Let's see, question listening example. And so, the practitioner, tell me about that. Ask a question, and then so in your pain is fairly constant. So reflection, and then he does a question, and reflection, and the question. So trying to do 2 for 1. You can read this example too. So the goal is after, so the goal is to, after you're done listening, is to summarize what happened. So, okay, so it sounds like, you just talked to me about, how smoking has been getting in the way with, being able to do things with your family, and you're noticing that you are, your breathing has gotten harder to breathe, and then whenever you run, you get short of breath, and you would like to consider the possibility of not smoking as much, or at least looking at different options as far as how you can smoke. Is that correct? Would you say that's about what we talked about? And that summarization, you use the things that they've said during the conversation, and you sort of bring them back up and sort of summarize the conversation you've had. Okay, and so here's your activity. Okay, here I'll go back here. So also, when you are doing the reflections, if they were to say something like change talk, you would really want to specifically reflect on that. And I have an example here of reflecting change talk, and so here you have the this is the R that's indicating what the change talk is, and so. Well, it's not that big of a deal, really. It's simple enough if it's important. So popping in earplugs is something that you could do if you thought it was important enough, right? Sure, I could do that. So he's saying ability, right? And this is sort of, it's, possibly a reason, right? And so it goes down and, my wife gets frustrated with me when I don't hear her. There's a reason. So it shows you sort of the change talk and how these practitioners reflected on it. So it's worth taking a look at and reading through that and looking at that example. Okay, and then see, after the conversation, summarize what was said, including change talk you heard and reflected, especially commitment and taking steps. So this week, I want you to pick a patient. Honestly, you can pick multiple patients to try this on. You can do several times. I'm going to give you guys 2 weeks to do this in case you're at like the OR this week or something. But choose a patient, and before you begin your assessment on a computer, build some rapport, get to know the patient a little bit, and then just open up with a question. So just say, hey, so can you give me a little bit of, tell me a little bit what's going on, or can you, tell me what happened, or can you tell me what's been on your mind, and allow that question to sort of guide what's important to them, and then using a reflective listening, using silence, using facilitated responses to sort of allow them to continue talking and taking the conversation where they want to. Listening for that change talk, right? And highlighting it in reflections. When you're done with a conversation, this doesn't have to be very long. It can be 5-10 minute conversation. Say a little summarization, and then go back to your, don't leave, go back to your assessment that you got to do every morning and see what information you've gotten out of it. Plug that in and then just say, okay, now that we've talked a little bit, I just need to make sure I get everything else, and then go through the rest of your assessment to get that information. And then I'm going to have a little discussion board for you to put your conversation in. Because there's no class this week, this isn't going to be a graded assignment, but it'll be a part of your participation or professionalism points. So if you really just blow it off, it's going to affect your grade. But I think that this is definitely worth your time as an activity. Do this in your clinical. Put a little blurb, a little reflection online about it, and you don't have to respond to anybody. It can just be one blurb on a discussion board. But I want to put them on a discussion board just in case you really did find a lot of meaning in this activity and are interested in how other people did. Okay? If you have any questions, you can let me know. And also, please look at the handouts that I posted, that I showed you in this video, and read through those examples to help sort of give you an idea about what you're going to try to do this week. And we'll talk about next week as well. All right. Have a good week.